Nina Horowitz, welcome to our
Thank
little
you so
Coffee with the
much.
Podcast. Coffee with the Founder podcast, where we chat with people about why are you doing this crazy thing called a venture-backed startup? You got to
I'm
be rather
thrilled
crazy.
to be here. Yes, and also probably a little bit crazy.
Oh, you have to be. That's part of the deal. You're CEO of ImmuneBridge. This is biotech. You
Yes.
came out of Stanford. You're using AI, a lot of stem cell engineering stuff, to, let me get this, if I may quote it from the website direction, building the next generation of cell therapies. Tell
Correct.
us more.
Yeah, so cell therapy is an incredible industry. Cell therapies have cured people of diseases they certainly would have died from. We're talking like little kids with leukemia, nothing left.
Mm,
They get a
mm.
single dose of a cell therapy and they are cured, which seems like a miracle. It's just incredible science. The problem is it's a really, really complicated therapy because cells are
Okay.
alive
Yeah.
and they need to respond and interact dynamically when they're with their environment, which is a
Mm-hmm.
good thing in a therapeutic sense, but a really challenging thing in a manufacturing sense. It's really hard to make a cell therapy at large scale, high quality, consistency, low cost, all at the same time. So, for an example,
Yes.
generation one of cell therapy, it cost between $500,000 and $1.25 million per patient for a single dose. And that's something that if you have no other option, you would consider, but then it leads to medical bankruptcy. People call this
Yeah.
financial toxicity, all of
Yes.
this. So
Yes.
we want to build a new generation of cell therapy that is safe, affordable, and accessible for everybody who needs it.
Mm-hmm. Is that an AI issue, a scale issue? What brings down the cost? We all know the collapsing components of tech, for example. So that's why your iPhone isn't $500,000, for
Yeah.
instance. What is it in this case?
Yeah, so it's two problems. We see the quality and the scale as
Mm,
sort of mostly independent. They do interact with each other, but we're solving them in different ways.
mm,
So to bring the cost down, we do large scale manufacturing. And we do this with a proprietary technology that we have that lets us grow the stem cells in umbilical cord blood, which is like
mm.
0 days old, no viruses, super healthy, great source of material. There's units sitting in blood banks all over the country and all over the world. And so we do large
Huh.
scale manufacturing from that, which brings the cost down and helps with consistency. But then the question is, if you could pick any of the 800,000 units that are currently banked, how would you pick them? I
I don't
personally
know.
have no
Yeah.
desire to test them one by one or make my scientists sit in the lab and do that or look at all the different donor attributes, et cetera. And anytime you hear this is tedious and repetitive and too much data for a human to look at, the answer is AI slash
That's
machine
right.
learning.
That's
And
right.
so what we've done is we've trained these machine learning models on screening data that only we can generate. So we
Mm,
take a tiny sample of the cord blood unit. We do a mini version of the manufacturing process. We run the final cell product through all these different assays that tell us how well it will function in a patient. Will it kill
mm,
tumor cells? Will it make cytokines? Like all of these different functions that are important. And then we feed that data back into these machine learning models and we ask it to predict the next 100. So, okay, we've screened 100. Here's the top like 5
mhm,
or 10% that we would consider for a patient. Now, here's the attributes of the next 100, but we
mm,
haven't actually done our whole process yet.
mm.
Can you tell us which ones we should go for? And so every time we do this, our models get better and better and more accurate. And the goal is eventually we can just pick a top 1% unit every time, manufacture it at large scale, and get it to the patients who need it, ideally for less than $10,000 a dose.
Less than 10,000.
Ideally, yeah, that's the goal.
Will it ever go to 1,000? Do you think?
It could. I think that
Okay.
depends on the cell type, how you engineer it, and whether the cost of any of the other components goes down. But yes, I think it could.
Okay. Let's see if that can happen.
Yeah.
Let's see.
As long as insurance can handle, a reimbursement for a $10,000 therapy that's curing a patient, really that's where we need to be anyways. Most antibodies, antibody drug conjugates, in vivo delivery, all of that falls within the same ballpark. So
Yeah.
as long as we're not like forcing someone to choose between their health and their financial security, I feel good about that.
Mm-hmm. And that has been long a problem in the medical field
Yeah.
for sure.
Yeah.
Okay, Nina, you didn't start as a founder necessarily here. You are now CEO of ImmuneBridge. You came in as research. So how did this navigate up to now you running the whole thing?
Yeah, it's really been quite an adventure.
Yeah.
And it's something that I think is unusual, but I actually think that it was the right trajectory for me. So when I finished the PhD program, I was thinking, do I start my own company? Do I go into
Yeah.
academia? Do I work for like the Parker Institute? Do I join someone else's company? And I had some people interested in helping me start a company of my own, but I knew that there was so much that I didn't know. I didn't go to business school. I didn't know how to like put a cap table together or like a valuation or things like that. I was in the Nucleate incubator program, which was really good and it taught me a lot. But it was almost this thing where the more I learned, the more I realized I still didn't know. And so it was a question of, do I just take this crazy leap or do I do something first and kind of get my footing? And so I gave a talk at a conference and the co-founders of ImmuneBridge came up to me and said, we would love you to build out our research division. Will you start as head of research? And I was like, this is perfect. I get to think about the science all day long. I don't have to think about the budget or the fundraising or
just be in science mode.
Taxes or health insurance benefits. I just get to do the science. And I did that for 2 years and I was
that's kind of a dream I would find as a scientist. You're like, yes, just put me in the lab. I want to be in there. Yes.
Exactly.
Yes.
And this is like, I love the science and I do love being a CEO and I love getting to talk to investors and new partners and all of that. But I wouldn't want to be the CEO of a non-science company. Like it's really the science that I love. And my poor team, because I'm the CEO, I should just be like taking meetings all day long. And instead I'm like, hey, where's the data on this? Like, hey, does anyone have the graph of this? Like we have 4 different data channels and I'm probably like overly active in all of them. I'm in every science meeting still. It really is like what makes my...
No, Nina, I think that's just founder mode.
Yeah.
You're just founder mode on. Yeah. And also you're not running a 100-person, 100,000 group.
Exactly.
Like you're in, you have to be. You have to be.
Yeah. So 2 years as head of research, then was promoted to chief scientific officer, and then from there to CEO. And I think that promotion was because, and this is where my privilege shows, I'm from New York. I'm a yapper. I have the gift of the gab. I grew up with this huge Jewish family that was like so loud. If you didn't like yell your point very clearly, and
then you're out.
No one's listening to you. Yeah. So I grew up that way. And I think as we were going out to raise the round that we raised near the end of last year, it was clear we needed someone who could like pitch this vision and also the science in a way that was clear, compelling, et cetera. And so I worked with our original founding investor for a while as kind of like his protege. And he taught me everything about, you know, pre-money safe, post-money safe. What is a cap table?
Oh, yes.
And we did a couple pitches together and I watched him pitch and then he watched me pitch. And then eventually he was like, you can do this. Like, I feel confident going back to the board and saying that you can do this. And so huge shout out to Alex Jacobson. I will be grateful to him for the rest of my life for seeing that I had that potential and giving me that opportunity. And yeah, it's been a whirlwind, but I am really liking it. I mean, I get to travel all over the world and talk to people. I get to guide our strategic vision in addition to like the little science experiments. So I really feel like I have my cake and I'm eating it too right now.
That's the best.
Yeah.
Oh. What else have you learned now being CEO versus full-time scientist?
Oh my gosh, so many things.
Okay. And do you have
one that we were kind of just briefly talking about before this?
Yes.
Is like, being a leader is really challenging, and I am learning that every day. I mean, science is so hard. Interpersonal dynamics are hard. Motivating people, being strict, meeting deadlines, being fun, like wanting to be friends with the people that you work with, but knowing that you're also their boss. It's like all very complicated.
Yeah. And I love you. Here comes your cat too. She's like, hey, I'm here.
She's like, my mom is really strict. My mom will yell at me on the kitchen counter. Yeah.
So how are you dealing with that?
It's been interesting. I have sought help from a coach. I am working with Enjoy the Work, great coaching firm. They've helped me a lot. We've done like a team offsite to really align. I think this is another thing I've learned is like I say something and then I assume that everyone 100% remembers that exact thing I said at one time on a Tuesday morning in passing, whatever. It's like, no, I have to say
Nina.
Something. Yeah.
You got to be chief repeating officer.
Exactly.
It's got to be 5-6 times.
Even better is like chief writing down officer. I'm a very verbal communicator, but I do think it helps to have a written, here's the expectation, here's the deadline, we'll check in a week or whatever it is. And so that's the other thing I learned is like I had in my head all of our different roadmaps, how they linked, why we needed this thing by this time. And through the initiation process of working with this coach, he was like, let's get feedback from everyone else, see, you know, how they see the roadmap, all of this stuff. And he was like, girl, you like, not everybody knows the whole picture here. Like everybody sees their part, but like they all have this kind of confusion of like, why are we doing this? What is this for, et cetera. And so then we've been doing exercises where every couple weeks we present one of these roadmaps. Here's the roadmap. This is why the timeline is this way. Here's what it unlocks. And so I think that's been useful for like building a better sense of security, understanding why we're doing this. And also I think motivation, because then you see what's at the end, which is like curing patients and like growing the company and helping other companies make their cell therapies better. And so that's been really good. But in my head, I was like, no, everybody knows what we're doing. He was like, no.
Sadly, no.
Yeah.
No. So much time. I wonder if you did a survey on this, and I haven't seen any stats on this, but just so much time is in the communication of, does everyone know where the ship is going, why we are going there?
Yeah.
Why we are doing oh man, it's chief repeating officer. Everything is comms.
That when you find a company that's really mission oriented, like that why is always clear. Like we're biotech. Everyone's in biotech because they want to help the patients. And so my sense was like, well, as long as we know the why, then everything else should also then be motivating. But it's like you need to know why your thing helps that core why. Otherwise, why are you doing it?
Why are you doing it? Why do you keep getting up, Nina? Exactly. Okay. One of my questions I love to ask on here is, what have you changed your mind on recently?
Yeah. Ooh, so many things. I guess one is like our competitive landscape. So I used to think all I have to do is beat autologous cell therapy, which is so easy. It's like, okay, I just have to beat my 90-year-old grandma in this race at like the family reunion and everything's gonna be fine. And it's like, as long as we're making it less than $500,000 and more than one dose per manufacturing run, we're good.
Awesome.
No. Here comes your super fit cousin who used to be like 7 years old and now he's on the high school track team and he wants to win the family reunion race. And I was like, oh, and that's in vivo delivery. So in vivo delivery is a new way of making cell therapy.
Great analogy. Oh gosh. Yeah.
Thank you.
Yeah. Okay, wait, go back to it. So your fit cousin comes up and they're doing
what? And now I'm like, oh, I have to beat this guy in the race. Oh no. And that's in vivo delivery. So in vivo delivery, because you make the cell therapies inside the body instead of outside the body, it costs way less. It's standardized manufacturing and you just give it and then the person makes their own cell therapy essentially. It's really cool.
In your body?
In your body. So you just give the engineering, like the virus to the person, and then it engineers the cells inside their body instead of the way it used to be, which was you take the cells out of their body, you engineer them and you give them back. So what that meant was every manufacturing run was done for a single patient. For this one, you do a big manufacturing run of just the engineering virus, and then you can give that same one to each different patient. So now they have the scalability and they've brought the cost down too. But in vivo delivery is only going to work for certain indications. It's going to be for things where you have enough cells in your blood that you can target and where your cells are functioning healthily. So if you have a really old patient or someone who's gone through chemo or these different kinds of things, or if you need a rare cell type, or if you need to really like change the phenotype or the functional state of the cells rather than just what's already circulating in the blood, it's not going to work. And so maybe now what I realize is I'm not going to be my cousin at the sprint, but there are other events at the family reunion that I certainly am going to win. Like the Frisbee toss, that's going to be my event. And so I used to think, yeah, all I have to do is beat autologous cell therapy and everyone's going to love it. Now I've realized I need to be competing at the same order of magnitude cost and scale as in vivo delivery and going after the indications that in vivo delivery is not going to solve. And at first I was really frustrated, like the bar got raised, but when I go back to my core why, I'm happy that now there's a new technology that can help these patients. And we all just have to figure out where each of these technologies fits within the overall engineered cell therapy ecosystem.
It's similar a bit, I'd say, to climate tech, where even competitors are really frenemies because ultimately we want all the temperature to go down or
100%.
Whatever it is. We all want a patient to live and so forth and not have diseases, but they're your competitor at the same time.
Yeah. So, that's been a cool thing about the allogeneic cell therapy space specifically is like, I'll go to a conference and I'll give a talk and other people give talks and we're all so open and we ask questions and everyone wants to help. And then at the end, I end up leaving with like 3 or 4 new collaborators typically, like especially in an emerging field. Everyone's aware that a rising tide is going to lift all boats. Like if you win for allo cell therapy, I immediately screenshot it. I send it to my chief of staff. I'm like, put this in the next investor update. Like this is great for us.
That's awesome.
Yeah.
And how great that you can go to a conference and come back with, collaborators, people can get on the phone, even if they're like, well, we're kind of frenemies. Yeah. Okay. One question. I haven't asked this one in a while, Nina, but what's your favorite emotion and why?
This is like so annoying. This is the most annoying answer. If I heard someone say this, I'd be like, wow, I hate that person. But it's
What?
being right about something. Like when you think that an
Oh,
experiment is going to work and you spend like
yes.
months debating and planning this experiment and then like executing it, whatever. And then
then
you see the data and you're like, it worked. I thought it was going to work. It actually worked. I love that
there
feeling.
is nothing like that. Oh
Yeah.
my gosh.
And I think
I
that's
am
from
with
the
you.
years of like slaving away in the PhD. Like an experiment would literally take me 2 months start to finish. And it's like, did I just waste 2 months of my life and set back my graduation clock? Or am I now 2 months closer to like publishing this thesis and like showing that this technology is true? And that also happens when like if a song comes on the radio and like in 2 seconds, I'm like, I know what song that is. Or like guessing what
Exactly.
song someone's going to play at a concert. I love doing that.
What would you call that though? It's almost like a righteousness.
I would call it intellectual self-validation, like just trusting my brain and learning to consistently trust my brain and go with what I think is right. I think especially as a woman, oftentimes you kind of anything you say it with a caveat. You're like, oh, but it might not be like this, or like, oh, I think this might be blah blah blah. And I think like the more times you're right, the more you learn to trust yourself. And then actually the more creative you can be, because you can start to think outside of the box, but you have all of these other times when you could trust that like intellectual instinct. And then I think that's where the magic happens.
I'm going to think of that intellectual self feeling, if we can name it specifically. Okay.
Just hacking yourself.
It's okay. So that my other thing. Do you have a hack? You have an unlock of late, Nina?
Not of late. I learned this in grad school. I had an ADHD coach. Her name was Ailey. She changed my life.
And changed your life. How so?
She genuinely changed my life. And my hack is, despite what I just said about like trusting my thinking ability, I have zero trust for my remembering ability. And I just needed to learn to accept that no matter what, if someone told me something, ironically enough, I know I just said that I thought if I said something, everyone would remember it. If it's in my brain, like verbally, it's in one ear, out the other. It doesn't remember how important it is. I have to move my car or I'm going to get a ticket. I park my car and I'm like, I need to remember in 2 hours to move my car. If I do not set an alarm in that moment for 2 hours from now, it's not going to happen. And so I have learned that everything has to be written down. And actually that creates more peace in my brain because I'm not always looping being like, what did I forget? Oh, I need to remember.
This. Oh my gosh. My whole team knows like I'm a hand to paper. And there's a lot of evidence showing that the hand to paper actual is a much more cognitively rich experience and memory jogger as well. But I'm the same. If it is not written down, it is, I cannot hold it in my brain.
Yeah, I've actually now even noticed, speaking of the note-taking thing, like now you have granola and all these other apps that will just take the notes for you.
Yes.
I feel like even at least attempting to like type some notes during a meeting bigger than that, like whatever you're doing, like the active process of being like, this is important, I want to look at this later.
Exactly.
And now I worry that like everyone just kind of phones in their meetings and assumes that like granola will remind them later what's important. And then it's like, will it actually? Do you trust AI that much?
I know. I feel like it's getting people too soft, frankly, because you're not engaging the mind and your listening skills are part of the hand to paper or even the typing, but really it's hand to paper. When I'm meeting in person with folks, I love the notebook and I'm just usually scribbling stuff the whole time.
Yeah.
So I'm capturing and I'm looking, just the piece of it. Yeah.
100%. I am really worried about the next generation of kids growing up with just like, I mean, so I was a 90s kid. So I was the first generation with everything at their fingertips, quote unquote. But now it's like, they just scan their math homework and then it like gives the answers or whatever it is. It writes the essays for them. Like I'll admit I used, was it Spark Notes back in the day?
Oh, yes.
Like I just need a quick.
Remember Cliff Notes too?
Yeah.
Oh my gosh.
But like everything else you had to write. You had to pull the all-nighter. You had to essay. You had to rush and print it right before class. Now it's just like ChatGPT or Claude can do it. And it's, I don't know. Maybe our roles in the world and what we have to think about and the work we have to produce will change as a result, but I'm definitely worried.
Yeah. Although I know a lot of folks are going just back to Socratic message.
Yeah.
Great. Your dissertation is you standing up, no notes, in front of all these people for an hour.
Yeah.
Go.
Yeah. And maybe that's better. Like maybe
that is
discussions in class instead of everybody writing an essay that only the teacher reads.
I think that's the return to real intellectual stimulation. How much have you mastered a topic if you can stand in front of a group get the lampoons of questions,
Yeah.
think on your feet,
Yeah.
articulate the answer.
100%. I went to a liberal arts college, and I think that's like unusual for someone who ends up with an engineering degree, but I'm so glad I did it. I took these classes that they were called tutorials, and it was 2 students and a professor. And every week, one student wrote an essay on the topic, the other one read their essay and wrote a rebuttal, and then brought it to the professor, and then they debated. And then the next week, the second student writes the essay, the first writes the rebuttal. It was so fun. I did one about Carmen, the opera, like history of Carmen interpretations throughout the ages, all the way through the Beyonce version. I did one on astrobiology, like what life looked like on other planets. Yeah, it was so much fun. I loved being a liberal arts kid. I really took full advantage of that liberal arts.
Probably helping you be on the CEO front now too.
Yeah, I think it made me a good writer, a good critical thinker. Yeah.
Well, history majors, for example, are the hottest ticket apparently now to
really.
Yeah, like just good people studying history. Yeah. Yeah. I know also creatives in this moment too, because you can't teach taste.
No.
And nuance. And that is what is missing in the smoothie, as I call it, of AI. It's like, oh, it's just bland across. If you just blend everything, it's just bland. It's a bland taste.
And you can
doesn't have taste.
You can smell it. Like every so often I'll get an email and I just know the email was written by Claude or you couldn't take the 2 I'd rather see a typo at this point, you know?
Well, that's a new hack. Put in the typos, put in the extra spaces, put in the little weird smiley faces, whatever.
Like, people love models that aren't like conventionally pretty, but they have like a tooth gap or like some other unusual facial feature. Like that same thing is happening now, I feel like, with just communication.
Oh, yeah. Yeah. And that from a beauty standard has gone back to differences and so forth, because everyone's like, why is everyone a blurred Instagram face with no wrinkles?
Yeah.
What is happening? Gosh. Isn't it interesting how the pendulum swings, Nina?
Yes, it is true.
I hope in the next couple of years, there's just the full swing of like, we're just going to go, to taste and distinction and to basic Socratic method and lecturing and being in person, handwritten.
I have a handwritten birthday card from my husband right next to me. It was like my birthday last weekend. And I was like, I love this so much.
Oh, I love I write a handwritten note to my partner every day, pretty much.
Oh, that's
he
really
usually writes me too. Yeah, it's great.
I love that.
Okay, Nina, in solving all these things for people so they don't have to pay, $1 million to save their little lives, anything else you would like to convey as it relates to, I'm doing this more, communication, media relations, the need to tell stories?
I think the human element of all of this is important. And I think especially as scientists, it's really easy to get lost in the sauce of just like technical details of like, yes, we're training a machine learning model on the donor attributes of for like the functional multiplex, blah, blah, blah. I do think it's important for everyone to remember that there's people on both sides of the screen. And so if I'm telling this story, whether I want an investor or a potential patient or partner or whatever to read it, it should be a human story. It should be, here's me, here's why I care, here's what we're doing in a way that's digestible and understandable. And if we all work together and fight for this, like, here's the future, right? Like I have this quote that I love using. It's from the first liver transplant doctor. He said, the history of medicine tells us that what was inconceivable yesterday and barely achievable today often becomes routine tomorrow. And so if we can do that for cell therapy, for in vivo delivery, for ADCs, for all this technology, like people don't have to be scared anymore when they go to the doctor, because the doctor will be like, hey, I did this test. You have this thing. Look, this is going to cure you. You don't have to worry about the cost. It's safe. You can take it and I'll see you in a week.
Yeah.
Like if we can really do that, that's amazing. And so I do think looking around at all this technology now that's like in these early stages and being like, we're going to laugh at this in 10 years.
Oh, we will.
Easy, that's the goal.
Very true. Nina, thank you for being on and chatting with us on our little coffee with the founder.
Time.
Oh, appreciate you so much, and hope your cat gets better with his eyeball.
In fact,
you have him.
He'll be just fine.
Yeah, is he down there? Do you see him? The little flower petal. Let's have a little show because it's so cute.
Hi, sweetie kitty. How you doing, man? How you doing, buddy?
It's not the cone; it's a flower. I really love that.
We call him our flower prince. He walks around and it kind of like it goes like this with him, like his shoulders a little bit. Yeah, he's the cutest. He's gonna be just fine. He has a vet ophthalmologist appointment. I haven't even had my eye doctor visit yet for the year. I need new glasses, minus scratch. He's going to the eye doctor before I do.
Cats are the new pets. or
Cats are the
pets.
new, yeah.
Pets are the new kids.
Yeah.
Yeah, cats are the new pets, and pets are the new kids.
Yeah.
Yeah, man. Nina, thank you again.
Of
Great to
course.
see you.
Thank you. This is so fun.